Welcome to Rideout Connection, Episode 4. My guest today is going to be Chuck Smith, who's the Public Information Officer for Sutter County and a local amateur historian. One of the things we like to do is really weave together the stories that we become part of as we continue to live, work, and serve here in Yuba and Sutter County. And I'm excited to have that conversation today. But first of all, I'd like to start with an expression of gratitude for all the associates and the physicians and providers for Adventist Health and Rideout, who over the last couple of months, we've had to deal with a significant surge of COVID patients in our community. There is not a part of our health system that has not been impacted by this. We know that we're faced with staffing issues throughout the organization, and we've seen a level of sick patients that we didn't even see in our surge over the winter time. I just want to say thank you to the heroes, whether you work in the clinic. Yesterday, I got to spend an afternoon with our staff in the urgent care center over on Bogue Road in Yuba City, dealing with, again, overwhelming volume of people needing care, needing COVID tests. What I've seen in our emergency department that's hit record levels. We have more intensive care patients in our hospital than we've ever had before. And all of you are going way above and beyond to make a difference to your patients, to support each other through this, and really show a spirit of resiliency that I become so inspired by as I've had the opportunity to work with all of you. Today we had the opportunity to recognize one of our associates, Travis Blass, who works in the radiology department. We were able to give him the Distinguished President's Outstanding Service Award. I only get a few of those to give out each year, and I got a lot of response about how deserving this young man is. He makes such a difference to the patients that he interacts with and the rest of his team members. And it just really embodies the spirit of our mission here at Adventist Health and Rideout. And so congratulations, Travis, on that award. You really inspire all of us. As we look at how we deal with this, one of the things I thought would be really interesting today is to look at the story of Marysville. Our hospital is located in Marysville, and there's reasons for that. And there's a reason that our city got its name. And I want to explore that because in those stories of our roots here at Rideout are stories of resiliency that go through the pandemic of 1918, and really the story of how this community has risen from significant challenges that it's faced and continues to show up stronger each year that passes. Much of what we do as we pursue excellence at Adventist Health and Rideout is within that tradition. And we are part of that rises out and raises a level of quality and excellence in this community. And so thank you for your efforts around that. As the pandemic faces us, we're really focused right now on getting people vaccinated in our community. As I said last week, this surge has impacted largely the unvaccinated population and is amplifying its spread in our community. Please get vaccinated if you haven't, if you're thinking about it, and encourage others to as well, because that's how we can all work together to make a difference. Welcome, Chuck. I want to thank you to our episode 4 of Adventist Health and Rideout Connection. And one of the things I want to talk to you about is the story of Marysville. How did Marysville get its name?
Well, Marysville's named after Mary Murphy Covalon, the survivor of the Donner Party. Her story can be found in this very room, the California room at the Yuba County Library. Well documented in various publications here. This index, these drawers here are filled with an index that was 30 years in development by a gentleman by the name of Earl Ramey. And all this information you can now find online thanks to a Rotary Club project and Yuba County and the Appeal Democrat. Mary's story found here is one of she was 15 when her family left. Family of 13 left from the Midwest. She was born in Kentucky, and she and her family traveled with the Donner Reed Wagon Train Party. They were infamously trapped in the Sierra Nevada at Donner Summit, and in the winter of 1846-47. It was a terrible time. They lost, I believe, 6 members of the family. The remainder of the family, when they were ultimately rescued, settled in this area. And Mary married Charles Covalot, a Frenchman who at that time owned a great deal of the property here. And when it came time to, in January 18th, 1850, when the community decided they were going to create a local government so that they could record documents, transfer title, engage in capitalism. They needed a local government in order to do that. They created that, and the town decided to name it after Mary, the wife of the largest property owner. One of the very few, one of only 2 cities in all of California named after a woman who's not a saint. Like Santa Barbara, Santa Clara, all those, right? Yeah. So at any rate, that's Mary's story. Now she, when the Donner Party was rescued and she'd lost her mother, she wrote family back home about how despondent she was and actually wished upon herself that she had died with her mother. That's how despondent she was. But she actually went on to become what's been described as basically one of the first social workers in all of California, because she understood that want of the lack of food and the suffering and all that. So she has represented Marysville well through the decades as a namesake.
Thank you.
Yeah.
Now, there's another woman who's had tremendous impact here in the community, which lent Rideout its name. Tell us about the story of Phoebe Rideout and why she decided to start this hospital.
Phoebe Abbott was her maiden name, who came to Marysville across the Beckworth Trail, from what I understand, clutching a chicken, her chicken, the whole way. The Beckworth Trail is now Highway 70 that comes through. She married Norman Dunning Rideout, and he was an early he was an early financer. He was involved in the gold trade, established the Rideout Bank, which became ultimately Bank of America. Phoebe, after her husband passed away and she lost a son in a mining accident, she dealt with that tragedy. Her resiliency was built up by giving the gift of the family mansion at 5th and E Streets, where the Hotel Marysville is today, as the first hospital. And that was Rideout Hospital. And later, she formed a trust company, donated some additional land over 8th Street, where the hospital is today. But it was Phoebe's gift of the community that established all of that.
Wow.
Yeah.
Yeah. As I tell the story to new orientees about the history of caring and really reaching out and being available to the poor, because back then medical care was very personal. Doctors would go to people's houses, but oftentimes the poor couldn't afford the little bit of money it took, and so hospitals formed really to care for that. So it's really neat to see the history in this community and how deeply rooted it is in our tradition of service through our mission at Adventist Health and Rideout. So this has been an interesting time. We talk about it as a time like no other when the pandemic hit us in 2020. But there was a pandemic before, the flu pandemic of 1918. Tell us a little bit about how that impacted this community and how this community responded to that.
Well, one of the more interesting things I've discovered in the Ramey Index and the digital reel that has all the newspapers from this community. What I came across these ads, full-page ads funded by the local business community, encouraging people to wear masks. They were published in the October of 1918, November of 1918, September of 1918. In particular, a lot of articles about how the local government dealt with orders about not assembling in various things. You didn't have as many letters to the editor, and you didn't have Facebook and response, but it's pretty certain there was also pushback in the community to that, because there's a history. There are documented incidents of, anti-vaccine movement or anti-mask movement during that pandemic. But I was struck by the fact that the business community stepped up and was funding these full-page ads. There are other examples through the years of this community dealing with tragedies and recovering. And in particular, flooding is a big concern in this region. There have been a number of floods, and in each instance, the community, came together and dealt with the aftermath. That's been a tradition. We know what happens. This community also reaches out a great deal when there's disasters in other communities, because we've had our own. We understand and we help out. But it's fun to be able to, through the resources here in the California room, particularly those online, being able to go find those stories of how the communities reacted.
Yeah. No, and I know at Rideout, after the campfire, it was fantastic to see how our community embraced the people from Paradise, both those that relocated to our community. But we had over 100 associates join us from Feather River Hospital who came and became part of the Rideout family. And I still see them. I was walking through the emergency room last week and saw a nurse who had just started her nursing career on the day of when that fire hit. It had just been there a little while as a new grad. And she works in our emergency department now. Looking forward to when we get services reestablished up there. But again, just a spirit of togetherness that shows a resiliency. That resiliency is really in our spirit, and that's really what our mission is all about. Rooting into the stories of this community, remembering that we've come through times even worse than what we may be facing now. It's important to remember that when we're focused on what we do for each other, when we lift each other up, when we support our community, this community embraces us, and we see many examples of that. And I want to thank the community for all you've done, for donated meals for our staff, for the support, for letters, for the donation of personal protective equipment. It is an honor to serve this community, and we at Adventist Health and Rideout appreciate seeing the spirit of the story of this community that's played out for over 160 years be one that we can experience today as well. So thank you for joining us for Adventist Health and Rideout Connection, and I look forward to our next episode. Thank you, Chuck, for joining us today.
Enjoyed it.
All right.